Coming up on Medical Economics Weekly, a shortage of IT workers is causing problems in healthcare. Half of all eligible providers have received EHR incentives. And could the new Xbox be a healthcare tool? All of that and more coming up. You're watching Medical Economics Weekly. I'm Kevin Stout.
I'm Brandon Glenn, and this is the show where we keep you up to date on trending news about healthcare, practice management, and healthcare social media.
A report by PwC Health Research Institute made clear that the shortage of health IT workers is much larger than expected, probably due to increased regulatory requirements from the Affordable Care Act increasing the need for these professionals to manage data. The report claimed that 80% of healthcare CEOs plan to invest in IT in 2013, but 67% of the responders reported already facing IT shortages. Worse, 62% of executives are concerned about a lack of skills available in healthcare IT. This led to 77% planning on trying to fill these roles from other industries. Daniel Garrett, PwC's health IT practice leader, was quoted saying, "Despite billions of dollars spent investing in HIT, the lack of qualified professionals could slow progress towards quality and efficiency. The benefits of HIT will not be realized until organizations can ensure information is unlocked and integrated in a way to best inform critical business and clinical decision-making."
Has the United States reached a tipping point in the adoption of electronic health records? Health and Human Services Secretary Kathleen Sebelius believes we have, with the recent announcement that more than half of all eligible providers in the U.S. have received incentive payments through the federal government's EHR program. The numbers from HHS are impressive. For example, the agency says that physician use of health IT has more than doubled since 2012. And the gains are even more dramatic if you go back a few years. In 2008, just 17% of eligible providers had adopted advanced EHR systems. Now, that number stands at more than 50%. In 2008, just 9% of hospitals had adopted advanced EHRs, while today that number stands at 80%. Plenty of doctors will no doubt disagree, but HHS is sticking to its story that electronic health records are already helping to improve care across the United States.
With all of the huge developments in mobile health and healthcare IT, Marcello Calbucci is making a bold statement about the future of health technology. Calbucci is the co-founder and CTO of EveryMove and a former development manager at Microsoft. He believes that Microsoft's new gaming console, the Xbox One, will do more for the evolution of health technology than any device since the smartphone. The new Xbox with its Connect 2.0 technology will allow for new health-related apps that can tap into more information about the human body than currently available to consumers. If you're unfamiliar with Microsoft's Connect technology, it's a sensor that's mounted on top of a TV with a high-resolution camera, an infrared camera, and high-fidelity microphones. That hardware, along with the Connect software, allows the gaming device to function surprisingly well with fitness games. Calbucci expects the future of these games to not only tell you how to perform certain exercises, but correct mistakes users are making as they're making them. But these fitness apps aren't the only health benefit he sees in the new Xbox. In a few years, Calbucci expects apps to allow users to measure their heart rates and even heart rate variability. Researchers at MIT have already demonstrated this kind of use of the technology. He also sees the new Xbox One playing a role in telemedicine, true METs, personal training, and more.
The independent practice is not dead yet. A new survey of about 2,100 physician practice owners shows that 58% say they are not looking to sell. That might come as a surprise to people who've been watching trends in physician practice ownership over the last few years. For example, a widely cited report from Accenture a few months ago predicted that by the end of next year, just 36% of physicians will be independent, down from 57% in the year 2000. Interestingly, the survey of physician practice owners found that solo practitioners are the most interested in remaining independent, with 65% of solo practice owners saying they don't want to sell. For you brave and hardy physicians who want to remain independent, several analysts advise focusing on one thing: maximizing the value you provide in patient care.
Live social media coverage of surgeries is becoming more and more popular among hospitals. The most recent occurrence of this type of broadcast was from UCLA. The UCLA Health Twitter account used Vine and Instagram to chronicle the implant of a brain pacemaker, a device that counteracts Parkinson's disease. To those unfamiliar, Vine is a Twitter-owned app that allows users to share short, 6-second videos that loop. One Vine announced that this operation was the 500th time that it's been done at UCLA. Take a look at that Vine now.
Go ahead.
So today we're going to be doing the 500th deep brain stimulation surgery at UCLA.
One of the other Vines showed the patient being prepped for surgery. See more Vines from the surgery by following the link in our show notes.
A recent article in Medical Economics examines the cost of transitioning a practice into a patient-centered medical home, monetary and otherwise. Some experts say the biggest cost of becoming a patient-centered medical home, or PCMH, is cultural. That is, how you use technology and integrate it into your care. However, a report from the Commonwealth Fund found the monetary cost to be staggering. The report used data from 35 practices that had transitioned to a PCMH and found that the average cost per full-time physician was around $517,000. Now granted, that report is a few years old. Most research suggests that the biggest costs associated with becoming a PCMH go toward technology and staffing. Now of course, the hope is that by transitioning to a PCMH, a practice's reimbursements will grow. Most commonly, commercial payers will pay traditional fee-for-service plus an additional payment based on the number of patients enrolled at a practice for a PCMH.
Dr. John Mandrola posted on popular physician blog Kevin MD with 10 simple rules that all doctors should follow on social media. He began by mentioning the 14-page manual the American College of Physicians and the Federation of State Medical Boards came out with on how doctors should behave online. He, of course, thinks this is a bit too long. To simplify, he gave his 10 rules that doctors should follow. His number 1 rule, do not fear social media. He names social media as one of the best ways to help educate patients with unfiltered information that they are looking for. The other rules include, never post anything when angry, strive for accuracy, when in doubt, pause, don't post anything that can identify a patient, ask permission, be respectful, assume beneficence, be careful friending patients online, and educate yourself and ask questions. Dr. Mandrola expands the rules on his blog post. Read more by clicking on the link in our show notes. And now for our tweet of the week. In reply to a comment by user ImagesMD about drug lobbying affecting the cost of prescription drugs, user IMH Horowitz replied, "Prescription plans run by third parties take most of the blame, in my humble opinion." Thanks for your feedback, user IMW Horowitz, and to be featured here, mention us on Twitter at MedEconomics. Thanks for watching Medical Economics Weekly. To get more episodes as they're released, please subscribe to our YouTube channel, follow us on Twitter at MedEconomics, or like us on Facebook at facebook.com/medicaleconomics. And send suggestions and feedback to bglenn@advancedair.com or kstout@advancedair.com. Thanks for watching, and we'll be back soon with more healthcare and practice management news. Don't miss it.